To our evening webinar, where we'll have a presentation from our colleagues from the Moi University in Eldoret. Okay, our participants were ready. Okay, I'd like to introduce Dr. Kibosia Caroline, who was the first dean at the University of Moi University. Welcome. Is also a consultant pediatric dentist and senior lecturer at this university. We are joined also by Dr. Diana Rop and Dr. Zipporah Rop, all of them from the Moi University. They're there. I don't know if there's a connection between having Rop's department, but it's interesting that we have Dr. Diana Rop and Dr. Zipporah Rop. Okay. Dr. Kibosia Caroline, if you'd like to start, you can go ahead, and the panel will go through the presentation. Please hold on to questions till the end of the presentation and put them on the question and answer section. Should you wish to greet your panelists, use the chat section. Welcome, Caroline.
Thank you. Let me start. Good evening, everybody. I'm trying to start sharing. Nick, it only says only host. I don't know why. There you go. There you go. So good evening, everybody. As I start sharing the PowerPoint presentation we have prepared for you, the slides, I will just make a few comments. The first comment is, welcome to all of you, and thank you for joining us this evening. And before we start the presentation, I would like to just give a couple of comments. The first one is that for us as dentists and clinicians, we really put a lot of energy into our patients' needs and a lot of energy into the technologies that help us treat our patients, as well as new materials and all the things that our patients benefit from. However, once in a while, we need to take a step back and look at where the community where our patients come from, and see what is happening out there. And for us today, we'd like to share our story of what we in Moi University, Uasin Gishu County, Kenya, have seen when we took a step back to look at our community. So our presentation this evening is called Oral Health, Well Mother, Well Baby. This is a project that is in Uasin Gishu County of Kenya, of which Eldoret is the headquarters. And you've heard already that we are 3 of us in this team, both the 2 Rops, and they're not related, but they are friends and they're in the same department. So, and myself, Caroline. So I'll proceed. So this project was sponsored by the FDI, the World Dental Development Fund, who gave us the resources to be able to go ahead and do this project. And we have several partners. Our partners are, as you can see, we have the FDI, who are our supporters, Kenya Dental Association, we have Colgate-Palmolive, the County of Champions, which is Uasin Gishu County, and of course, in the middle to tie all these partners together is us from Moi University. So for us to appreciate where we are in Africa, because I know we have listeners from outside of Kenya, you can see from the map where Kenya is. It's on the eastern part of Africa, next to Tanzania, Somalia, Uganda, and Ethiopia, and Sudan. So we are right on the coastline. And if you look at the map of Kenya, Uasin Gishu is the area you can see in red, which is on the western part of Kenya, where we are actually, in Kenya, we have 47 counties. Uasin Gishu is county number, I think, 28. So we are on the western part, but we are generally known as the North Rift.
So in summary, we are going to go through a few slides, which will look at introduction, objectives, methodology, the project sites that we visited, how we collected data, the tools and the activities we had, the images, the little findings we can share for now, and the effects of challenges of COVID. So maybe just as an introduction, we all know that oral health, it qualifies to be a public health problem. And each of us definitely have had to treat a patient with caries, and the incidence and prevalence is very high. And there's a significant impact even to the quality of lives of those affected. Remember that the mothers and the children are a vulnerable group, and especially during pregnancy, there's a lot of hormonal changes that occur, and this may lead to deterioration of oral health. So children under 5 will always have poorly developed motor skills. They're not able to brush on their own, and they need their parents and caregivers. So they have a crucial role to play in regards to the oral health of the children. Now, oral health care providers in MCH will most likely not be able to encounter. The dentist will, the healthcare providers in MCH, sorry for that, the healthcare providers in MCH, the nurses, the nutritionists, will most likely be the first people to contact the under 5s. And therefore, these are the crucial people who will be needed in terms of promotion and prevention. So during this pandemic, we really need to step up in terms of promotion and prevention, especially diseases from childhood. So our objective was simply to design, implement, monitor, and evaluate oral health promotion and disease prevention tools that were to be made available for both the under 5s and the pregnant mothers at the 8 high-volume centers in Oangishu. All the authorization that was needed was done. There were a few specific objectives that we were looking at. One was to assess the knowledge. What is the baseline? What do they know? What do they practice? So that this could form a baseline for us to develop the oral health promotion and prevention tools. And therefore use these tools to train the MCH staff, because we realized they are the first line of defense in terms of prevention, and they are most likely to see many more patients that we do in our clinics. And once we did that, we would like to also determine the impact. What is the impact of this oral health training to the to the healthcare workers who are in the MCH?
So to begin the project, we had to establish a starting point in order to know what is it that the healthcare workers in ANC and in the child welfare clinic know about oral health in terms of knowledge and practice, and also to look at what is it that the clients know. So here, clients, we are looking at the caregivers who attend, who bring the children to the child welfare clinic, and the pregnant mothers, with the hope that once we know what information the pregnant mothers know, then we can be able to impart. After training, then we would be able to ensure that whatever knowledge the mothers have will hopefully transcend and benefit the unborn children in the future. So this pilot study was conducted at West Maternity Hospital, which is in the heart of Eldoret town. It's actually the biggest maternity. It's like the Pumwani, equivalent of Pumwani in Nairobi. And as we've mentioned, just to form the basis for developing the teaching tools once we know what our target population knows. And this was done in April of 2019. So this is just a photograph that was taken on the day we were doing the pilot. As you can see, Dr. Diana in this image, seated and doing a summary of the day's activities, seated on a bench where other clients, these are mothers who have brought their children for immunizations. And yeah, that's just a picture to show you that we did the pilot. So just to form also a baseline, we encountered this book. I'm sure some of you have seen this book in the public health facility, the purple book, as it's commonly referred, given to pregnant mothers. And it has a lot of information regarding the well-being of the child. And we just noticed that actually oral health only takes 2 pages of that booklet. And these are some of the photos that are on that book, just to show the set of teeth and the eruption time, and just a little information on the development of the mouth of the child. And we felt this was not adequate, and it forms actually a basis of the manual that we developed much later. So on the methodology, our study setting was basically, we selected 8 high volume centers in Uasin Gishu County. And we looked at high volume centers in order to be able to capture as much numbers as we could. And the study population in those high centers were the healthcare workers at the antenatal clinic, who work in the antenatal clinic and in the child welfare clinics. And then looking now at the clients, so the 2 categories of clients who are the study population were the pregnant women attending the antenatal clinics and the caregivers who accompany the 5-year-olds to the child welfare clinics. Other than the population in the hospital, we also looked at the key informants from the county office, and this is the chief executive member of health, together with the county director of health, the nursing officer in charge, who we believed were the policy makers, would influence policy. And also looking now at the hospital level, the hospital managers in those high volume facilities, to just give us a sneak peek about what happens in terms of oral health care in the specific facilities. So these are just the project sites. As you can see, there are 8 in number. All of them are the primary. PHC here means primary healthcare facilities. So we are looking at the MCH in the primary healthcare facilities, all distributed in the 6 sub-counties in Uasin Gishu. As you can see down here, Uasin Gishu County Hospital is a secondary healthcare facility, but we chose to include it because it has the high volume, and also because it also offers primary healthcare, an equivalent of primary healthcare facilities. In this case, they also do immunization and the routine antenatal clinics. So this is just an image now, from the map of Kenya. Now this is now focusing on Uasin Gishu County, and you can see the demarcation of the 6 sub-counties. So we have on the top left, that is Soi, coming down, Moiben. On the far left is Tarbo, then Kapseret down, and Ainabkoi and Keses. So, and these arrows are just indicating the location, geographical location of the 8 facilities that were part of the project sites. So in terms of data collection, we used tablets which had the ODK software. And the data was collected in 3 aspects. The first aspect was the interviewer administered questionnaire, which had both open-ended and closed-ended questionnaire, because we wanted to look at both, the quantitative and the qualitative information that was administered to both the healthcare workers working in the MCH facilities of the project site and the clients. In this case, the ANC, the mothers, pregnant mothers attending ANC, and the caregivers accompanying the under 5s. That was one category. The second category of the data that we collected were the focus group discussions, which are recorded using the tablet. Focus group discussions that were conducted after work in the afternoons of all the MCH staff. And the third category were the interviews now with key informants, who are the county staff, the policy makers in the health department, together with the health facility managers. And the two main information that we wanted to look at is in terms of the knowledge and the practice. Or in terms of the knowledge for the categories, whether they appreciate the importance of oral health, and if they can be able, if they know that there is a relationship between oral health and general health, and if they know some of these cultural practices that are existing in our society. Then in terms of practice, oral health education was key for the healthcare workers. Do they, in terms of practice, give oral health education?
Sorry about the connection. We hope we'll get back.
Can you hear me? So in terms of oral health education, whether the healthcare workers in the MCH facilities give oral health education to their clients, just the same way they give.
We be having a connection problem there. We hope we'll get back in a few minutes. Yes, okay. Now we can hear you.
Okay, sorry about that. In terms of education, whether the healthcare workers give oral health education to their clients, the way they give information to do with breastfeeding, for example, the way they give information about immunization and the importance of attending antenatal clinics, just to give an example. And in terms of practice, is for the the clients, whether they practice, good oral health habits at home, and cultural practices from both ends, whether they know about these cultural practices and whether they also partake of the same practices in the community. So this is just an picture showing our research assistants talking to the clients visiting the child welfare clinic, and using the tablets to administer the questionnaires. So, and this is an image where we're doing focus group discussion with the staff, all the staff in MCH. This particular facility is Moi Sub-County Hospital. That day it was really raining, and I had to stand to just be able to pass the tablet around and be able to capture the voice recording. And yeah, you can see we're all seated around in a table and having a discussion that really generated very interesting findings. So in terms of the tools and activities, once the pilot study was conducted, then we went back to the drawing board and used the information we got from the pilot now to generate appropriate teaching tools for the clients and the healthcare workers. So a training manual was developed, brochures, most of them in Kiswahili, based on the need and request of the healthcare workers who felt that the clients would appreciate the brochures in Kiswahili more than in English. Charts that were to be hung on the facilities waiting room and treatment area. And we were privileged to have some material from Colgate Palmolive, the toothbrushes, both for children in the child welfare clinic and adults, that is the mothers attending antenatal clinic, and also some record books just to have the record. So that was in terms of the tools. The activities, training. Now, after the tools were developed, then training was done to the healthcare workers in the facilities to enable them to now be able to identify some of the common oral health problems and refer accordingly. And now going further ahead in our third activity to do monitoring and evaluation, which we have done the first phase and is currently ongoing for June. So these are one of the tools. You can appreciate the image here, Daktari. This is our cover page for our manual, and it's actually a 20-page document, mainly for reference for healthcare workers while seeing patients in the in the MCH clinic. And we included both the brochures and the charts to be part of this manual. So this is the brochure, the back page of the brochure in Kiswahili, and the back page has information on the pregnant mother, afya ya mdomo katika ujauzito, and it gives all information that a pregnant mother needs to know regarding the oral health. So this is the front part of the brochure, or I can call it the inner part, that now has information about oral health in children, jinsi ya kutunza meno ya mtoto wako, and it has everything to do with oral hygiene, diet, and some of the issues that raise concerns in young children, like this case of natal tooth. These charts that we also managed to develop in Kiswahili, just to talk about the oral health of the child, afya ya mdomo, mwongozo wa afya ya mdomo ya mtoto. Now, and you can see now it just gives information right from the gum, when the child still has not developed the primary teeth, all through when they have the primary dentition, and information about the size of toothpaste that they just need to have on their toothbrush for routine oral hygiene. And this is a chart now that is to be hung in the antenatal clinic. The other chart is hung at the child welfare clinic, so that as mothers are queuing to be seen, they can have a sneak peek and be able to read the same information. And this now is hung at the antenatal clinic for mothers to just appreciate the importance of good nutrition, good oral hygiene, and avoidance of harmful habits, behavioral habits that can affect their teeth.
Sorry. So the next few slides are just to take you for a short tour, just to see where we were, and just to help us to open our minds, just as Dr. Kibosia said, you know, that dentistry is just
Sorry,
the way.
we seem to have dropped out there. Let's see if we can get
sorry.
connection back.
Okay. I hope you can hear me now.
Dr. Rop, we hear you.
You can hear me now?
Yes, we hear you.
Okay. So this is just Ziwa Sirikwa Sub-County Hospital, and this was one of the trainings that we did. And the staff was
we hear you.
You hear me now, eh? Okay. And the staff were they were thirsting for knowledge. And the next slide also shows them receiving the material. And it was one of the most beautiful sub-county hospitals that we saw in terms of the landscaping. So this is just nice to know. Another sub-county hospital we went to was Eldorет, right in the middle of nowhere. But still, there was so many people thirsting for knowledge. Everybody wanted to know, how can we prevent oral health? And the next one shows another sub-county hospital in Burnt Forest. And they were receiving the Kiswahili version of the charts. Sorry, this was Tarbo sub-county hospital, where they were receiving oral health promotion materials. And you can see they have displayed, the next slide shows you where the charts have been displayed, right in the waiting area, either the waiting area or the service bay. And this is one of the service bays, so that the clients can be, the charts can be accessible to the clients. Okay, we also went to UG County, that is right here in town, and they also displayed their charts right there in the service area and the waiting bays. Okay, so that's still UG County receiving the healthcare manuals. You saw a sample, so we gave 2 manuals for each center. One for the NC and for the CWC. So you can see the charts have been displayed at the waiting area. Dr. Zippy is standing there, just to show that the patients, as they wait, they receive the information. Others wait 9 days and also get to receive the information. Okay, so this is also one of the facilities, Eldoret West, which Dr. Zippy says is equivalent to Pumwani. And you'll hear something interesting later on about Eldoret West. But you can see right there, that was the charts that they were receiving and some oral health prevention materials. Okay, this was also a training that we were conducting. Different cadres, nurses, nutritionists, mental.
Hello, Diana. Hello, Diana. We can't hear you.
And in charge of.
So this is one of the training areas that we are doing in Eldoret West Hospital. We trained, including the manager of the hospital was keen to train also. So this is Burnt Forest, which is a hospital on the Eldoret Nakuru Highway. Very, very busy. And this is us having our focus group discussion, as well as doing the one of the health cares, having standing next to the chair on the waiting bay. This is Moi Health Center, which is in the rural area of the maize growing area. As you can see, they also have a number of other things other than maize. This is one of the sub-county hospitals, which is also quite busy, and they have their charts on the waiting area. This hospital actually has a lot of space, so they decided to put their charts on the waiting area, which is a large corridor where there's all the patients wait, including they decided to put also other charts in their OPD because they felt like that they needed all their patients, not just those who come to CWC and ANC. They really wanted the patients who visit that center to get this knowledge. And this is us giving them then the training manuals and the Kiswahili charts also. This is Keses. Keses is on the Keses Sub-County Hospital. Is on the way to our main campus, the Moi University main campus. And this facility is also interesting because they see a lot of...
Sorry about the connection. I hope it's back now.
Hello? Can you hear me?
Yes, we can hear you. You can go ahead.
Okay, sorry. I'm sorry we lost each other. So I'm talking about Keses. This is Keses Sub-County Hospital, which is on the way to our main campus. And this facility sees a lot of our students who live, many of our students live out of town, out of this campus. So they visit this health facility. So we thought it is very important that we actually provide the service, we provide the training as well as and it's also a high volume center. So here we are giving them you can see Dr. Zipporah there, giving out material and the training manuals. Then we should not forget that home, they say West, but home is best. So this is us also handing charts to our dean and our head of clinical services at Moi University. So let's look at some interesting findings. One of the most interesting things that we found was that most of the healthcare workers were not informed about oral health at all. However, like Dr. Diana had said earlier, everybody, almost all of them were thirsting to get information. So when we were able to interact, they were willing to integrate oral health into their service delivery after the training. But before the training, it was like, what do you mean? This thing is going to increase our workload. We are already so busy. You want to add something else on top of what we are doing? And so it was like, okay, let's just take a step back and listen to what we have. But when we sat down, discussed, did the training, and then had the post-training discussions, the healthcare workers actually realized that what they could do is to integrate oral health into their normal work activities. So what led to this is that most of the healthcare workers were positive about the information on oral health. And after the training, after the charts were put up, after the brochures were given out and distributed, after the toothpastes and the toothbrushes were given out, during our monitoring and evaluation, the one we did in March, we realized actually the healthcare workers told us that the clients are asking more and more about oral health. What do I do if my child has this? The pregnant women were asking, my teeth bleed, what do I do? So the healthcare workers were no longer at a place where they did not know what to do. They were able to talk about it and give some positive information and also refer to the right places. So at the beginning, when we started, we thought that the target healthcare worker in the antenatal clinic and the child welfare clinic were the nurses. However, when we reached the ground, when we hit the ground, we found that actually it is a complement of workers, of healthcare providers that support the services of antenatal clinics and child welfare clinics. In one of the centers, we found actually a pediatrician, one of the rural centers, a pediatrician who consults right there on the ground. We also found that there are nurses, nutritionists, clinical officers, mentor mothers, public health officers, child community health workers, and community health volunteers. These last three in particular are the ones who are based in the community. And these are the ones that the hospitals use to trace their patients and their clients when they default. So these are very important cadre that we actually managed to also include in our training, although we had intentionally not thought that we would be able to do this, but we did do this. So another finding, about 100 meters from one of the health facilities that we visited was this daktari, who in that area is a very busy area. And so we asked them, are you aware that there's this daktari who does this quasi daktari, who does what he calls daktari ya kinyumbani. So when we asked them, they said, yes, we are very much aware that these people are there. So, but what do we do about it? They said, what can we do about it? Who is the one who should monitor? Who regulates these people? You see, that is a question that we'll ask all of us. These kinds of daktaris are all over in this country, in Kenya, and I'm sure all over other countries in Africa. And the biggest problem we have is that the community go there. So now what will happen during this time of COVID-19 when we know where the the virus resides, mainly in the oral cavity and the nose? What happens now during this time when our clients, our community people go to these daktaris? So that's a question we have not answered, but I think we shall discuss, all of us. So some of the effects you can see here. Many of the community members believe that children cough, the insistent cough, that it is because of the uvula. The uvula is long and it irritates the back of the tongue, of the throat. So what do? they cut it off. And who does that excision? The daktari that we saw earlier. So these are the effects, and we know that this is irregular, and we know that there are so many patients that they have either bled to death or they have had infections and all sorts of complications as a result of this. So here is another of the cultural practices, that this is a patient who came later on. Now this is a 4-year-old child, yeah, who came now. The parent was complaining that the child does not have the canines. We all know what has happened. They removed, when we probed, of course, we found out that the so-called the plastic teeth and the tooth jams of the canines were removed much earlier. But somehow it's interesting because the father is the one who brought the child together. The two, they came together with the mother, but the father did not know what had happened. Interesting. So what are the effects of COVID? As far as the centers that we went to, this project of ours is a 2-year project. It started in 2019, in January 2019, and it's supposed to end in December 2020. So we are like now 1.5 years into the project. So one of the biggest problems, of course, that we have had as the members of the project is we are not able to do some of the things that we had set out to do because of this COVID pandemic. So some of the things we have had to do is to change. Like, for example, we are currently at the monitoring and evaluation stage. So we've had to do some of the monitoring and evaluation via telephone, and then we look for a way in which we can now go and visit. But these are some of the things that we found. There is one center that we've seen, you saw, they have had no clients, not even a single client since this pandemic started. One center had initially few clients, and then, but with time, the numbers have superseded the previous numbers, which is interesting. 2 centers had client numbers reduced significantly because, again, of the fear. And then there was one center which experienced no change, absolutely no change. So one center also complained of high levels of stigmatization. This is the center that in Uasin Gishu has the highest number of COVID-19 cases. And in this facility, they really were feeling like they were being stigmatized. And the information we got was that the healthcare workers treat every single client they see as a potential suspect case. Those are not good words to use, but allow me to use them, but they just were fearful. These are the healthcare workers. The good thing is that all the centers were supplied with hand washing, water, liquid soap, and surgical masks for the healthcare workers. And in some centers, they even gave the clients masks. All centers except one practice social distancing. The one that did not practice social distancing is the one that saw no change in patient numbers and client numbers. And these facilities are very, very busy. So we are now in June. We've managed to see 5 centers in our monitoring and evaluation. This is an ongoing process, and we hope to complete it before the end of this month. So then the challenges, okay, there's an increased number of defaulters. I think that is expected. So even though some of the numbers are still high in some of the centers, these are new cases. Those clients who have been given, callback dates do not come back. So what they are trying to do is to use the community health volunteers to follow them into the community, to track them, and then ask them to come back. The healthcare workers also complained that they were provided with only one surgical mask for the whole day. So they go for lunch, they come back, that's the only one they have. that is now in a resource limited facility and country like ours. And then there was one center who said they were not trained, so they are still fearful, they don't know what to do. But I think this is an issue. They said they'll follow up with their facility managers and the county health personnel. So this brings us to the end of our presentation, but this is the contacts we left with our clients, and we will leave with you also. We acknowledge FDI for providing us this grant, KDA, Colgate-Palmolive, the Uasin Gishu County, our research assistants, our biostatistician and data manager, the dean of the school, and all the participating clients in the child welfare clinics and the antenatal clinic. These are our references. And now as we end, I think to us as a team, we work as a team. As you can see, we work as a team. What is our take-home message? What is it that all of us can do in the community that will change the lives of the community members in terms of oral health prevention and disease, oral health promotion and oral disease prevention, especially for the children. For those of us, I'm a pediatric dentist, and I really appreciate that we should begin prevention from the pregnant woman. And so here we say asante sana, shukran, merci beaucoup. And in Eldoret, in Uasin Gishu, we say kongoi mesing. And here I am with Dr. Linus Ndegwa, the president of Kenya Dental Association, who visited us in Eldoret. And here are Zipporah and Diana. You can see their bright smiles. Thank you, and thank you. May God bless you all. We have finished. Hello? Hello? Dr.
Oh, yes.
Noah? Yeah.
Yes, I'm here. Don't worry, the connection had gone off. Thank you very much, Dr. Kibosia and Dr. Zipporah and Diana Rop. Yes, we did hear you. I had to change to my phone. The connection was pretty bad, but I hope most of our participants got to hear what was mentioned.
Yes.
And I just want to say thank you for a lovely presentation and just showing us how vulnerable our children are in so many areas, not only in oral health, but it also puts a light on how vulnerable they are in other areas concerning their health and just their well-being. It has also put forward what a paucity of oral health information all of us have. And just within the health facility, all of us work within a health facility. We went to school for many years, but there's such a paucity of information concerning oral health and especially children. So we thank you so much for that presentation. There are some of you who have asked through your questions, how can they get this presentation because they were not able to hear. If you go into the KAPD website on kapd.or.ke, you can visit and see the recording that has been presented here and see the wonderful work that has been done. I just wanted to ask the team there. You told us you taught the people concerning toothbrushes and toothpaste. Did you also share with them other modalities of maintaining oral health, even if you didn't have a toothbrush or you didn't have toothpaste?
Thank you for that question, Dr. Noah. Yes, because we know very well that in many of our communities, many people use the traditional muswaki, which is something that is available in many of the communities that we belong to in Kenya, in Africa. So yes, we did share among what else you can do if you don't have a toothbrush and toothpaste, what one can do. The thing though that was interesting was that they were telling us what people do, what they are doing themselves. Like for example, cleaning with ash, cleaning with herbs, cleaning with sharpening some of their teeth using charcoal You see, so you see now the delicate situation here is where is the balance now between, okay, what to do when you don't have a toothbrush and a toothpaste, and which are the harmful habits that they need to discard, and which are the useful habits that they need to move on with. Unless Dr. Diana and Zipporah might add something.
Dr. Diana and Dr. Zipporah, do you want to add anything?
No, that suffices.
Okay. I don't know if I missed this in part of the presentation, but what information did you give to those who had children with neonatal teeth or plastic teeth, and concerning their fears and what they should do about them? How did you educate the healthcare workers? Because we know that lots of people have fear of having children with that, and they cannot go home once you give birth to a baby that has teeth.
I think Diana, can you answer this one?
Okay, let me try, because I think my network is on and off. So if I don't get through, just mute me. That's a good question, Dr. Noah. So the manual, what we showed was just a little sample, but the manual we developed was kind of like, I mean, it could not be comprehensive, but we tried to look at the most common condition. What will the nurse most likely be asked? And we know that one of the problems is the neonatal teeth, or, plastic teeth, as people said. So what we did, if we look at the manual, it has a little bit of knowledge. So we told them, when the first tooth erupt, when do you expect to see the first tooth? What would be the signs, and symptoms that most likely the mother will complain of? That may point to the tooth. And I went back about your teeth, and what I told them was just to try and give them a little bit of background in terms of, what is normal and what is a normal anomaly, So what we did was just to try and tell them from the dentist aspect and give them a kind of like a layman's view, but the good thing, they have a background of health. So
Hello, can you hear me?
Yeah.
Hello, can you hear me? This is Dr. Noah. Can you hear me?
I think Dr.
Yes, I can hear you.
Okay.
All right.
Okay. So I don't know, are you getting me?
Yes, we can we can hear you. We can hear you clearly. Thank you.
Okay, Dr. No, I can't hear you.
Oh, can you hear me now? All right. While your connection is coming through,
okay. Sorry,
some of the
probably my connection is bad because I can't get you.
Okay, all right. You can just try and reconnect. But as you're trying to do that, maybe the rest of the other presenters, Kibosia and Dr. Rop, are there soft copies of your booklet and brochure that can be distributed?
Yeah, okay. For now, because our project is
maybe
still
Dr.
ongoing.
Kibosia, you can pick it up because it looks like my network is not too good.
Okay. Yes. Our project is still, we are 6 months to the end, but we have been asked this question a number of times. So we are preparing the soft copies so that we can be able to share them, with all those who are interested. So anybody who's interested can talk to us through our email. We shall give you our email contacts. We have actually given you the email contact, and we can avail the soft copies.
Okay, thank you. And some of the, like Patricia has asked us, are there any special messages to caregivers of children with mental disorders such as cerebral palsy? Did you hear me there?
Yes. Zipporah, would you like to answer this one?
No, just go ahead, Doc.
Okay, right. So you see that the what we were doing, we were going to the primary healthcare facilities in the first line in the rural setting, and in these facilities, the patients who have those kinds of disabilities are normally referred now to the secondary healthcare facilities. Yeah, they're not seen there because of their nature of their disability. So in our project, we were targeting mainly those who do not have. These are well. That's why our title is well mother, well baby. Yeah. So I think now what probably is a next step is to look at how do we now target this other population of children with children with other needs, special needs, because there are many. So I think that is an area that we can probably look into, and other people who are listening in, that's an area to go in and see how do we target now this information to children and even adults with special needs. That would be my response.
Okay, thank you. Some people would like to know, is it possible to access the detailed study as well as the manual for those who are interested?
Okay, for now, because we haven't completed the study. You see, we are like 1.5 years into the study. So we need to complete the study and get all the results at the end. And then we can now share what it is, the full package. But for now, it is not possible because we're like 2/3 into the end of the project. But for us, we felt that we really wanted to share this project with everybody because we thought that it's something that is useful to those of us who like to work in the community.
It is a useful project, and we thank you very much for that. And people really love the presentation, and they just want to know if you could just put your slide on again with your contacts, because some of them missed that. Just leave it a little longer so that they can contact you and ask questions or get some clarification about things.
Let me just share. Just give me a minute, please. But you can be asking some other questions in the meantime.
Yes, as you're sharing that slide, I just want to remind people that if you registered correctly, your points will be generated accordingly into the ICPD for points. We want to welcome others in our group who are not dentists or pediatric dentists. Any other professional out there like the pediatricians, we welcome you and we thank you for listening in. We realize what a paucity of information we have concerning oral health, and the more people we teach out there, the better it is for everyone. I'm glad Dr. Kibosia talked about the special group of children, the ones with special needs. Already our children are vulnerable at the age below 5, but thank you for mentioning those ones with the special needs, and especially those children also who are lactose intolerant or can't take milk, and we know how that can affect their growth. So any last words or comments to people out there concerning just oral health and well babies and well moms to the team?
Yes, maybe I'll start. I'll say as oral healthcare providers and healthcare providers, because we should all endeavor to work together and make sure that we use each other's strengths so that we reach the populations that are in need. And my final comment would be, if you start little, and you start little, all the littles will become large. Thank you.
Okay. Do Dr. Rop, Diana, or Zipporah have any last words?
Maybe just a comment and about this presentation or the project. Teamwork is very essential, and I think it's high time that the healthcare workers, the complement healthcare workers who work in the MCH really need to be educated. And if something can be done in their curriculum so that they right from their training, they get to have this emphasis on oral health, then I think the bigger picture will be able to appreciate the bigger picture in the long run, as opposed to just relying on dentists and other oral healthcare workers like the co-host to pass the information. So I think it's good now to start working upstream rather than downstream.
Thank you for that. Dr. Rop and Caroline, you guys are done?
Yes,
Any other?
yes, we're done.
Thank you for the time.
Thank you for allowing us to present in KAPD. I think our KAPD has been very, very, very resourceful and supportive to all the doctors and all the friends of the pediatric dentists in this country, and we thank you very much for the role you're playing in making sure that information and technology is being passed around. Thank you.
Okay, Dr. Kibosia, before you sign off, could I ask you one last question?
Yes.
We have one who asks, do you have a comparison group for the study, and how did you handle referrals? Okay,
so we don't have a comparison group, because what we did is that we did census. What we did is that we saw everybody on that particular day that we went. So we did not, this is not really like a cohort or a case control, yeah, where you need a comparison study, a comparison group, a different cohort of clients. So what we did is just we went in, so that whoever was there in the facility on the particular day that we went. And what was the second question? Sorry.
Let me get that for you. What did you do with referrals?
Oh yeah, okay. So what we did with referrals, that one was very easy, because in Wasingishu County we have Moi Teaching and Referral Hospital, and we have the School of Dentistry. So we were able to ask all our healthcare workers in all the facilities to refer their clients, and we left them with contacts of people they could call and say, we've referred such and such a patient to you. So they were referring them either to MTRH or to an MTRH, were also aware that there'll be referrals, and to the School of Dentistry. So that was not difficult. And they've been doing, actually, as a result of our study, they've started calling and referring cases to us.
Okay. Thank you very much, Dr. Kibosia. Thank you, Diana Rop and Dr. Zipporah Rop. Thank you for putting that presentation together and just reminding us, as practitioners who work in the mouth, that we need to train everybody we meet. Train them, teach them, give them the information, because very few people have it and they don't know what to do, and they don't have a dentist near them. If you missed part of the recording, either because of network or you are not able to connect properly, please visit the KAPD website, kapd.or.ke. You'll get a recording of this presentation. Remember, if you registered correctly, your points shall be generated and given to you. And we just want to wish Dr. Kibosia and her team all the best as they go into the next phase. And we're looking forward to that presentation. Thank you very much.
Thank you.
Have a lovely evening, and God bless.
Thank you.
Thank you.
Thank you.